Okay, everybody, it's Landon again. I'm getting ready to do my arm dressing change, and I just wanted to show you, these are the bandages that the doctor will tell you to get. They're 5x9" zero form bandages. We're going to change my dressing on my arm so you can see how it's done, and you can see what my arm looks like right now. There's no way for me to pause the video, so I'm just going to keep it rolling, and you guys can just watch along, okay? Okay, so usually what I do while she's getting the dressings ready is I undo my arm. So I'm going to try to do that while I'm holding the video camera, so we'll see what happens. Hang on one second. Can't do it. Well, that's not going to work actually. She'll have to help me. I'll just hold the camera. She's going to have to do everything this time, so just keep watching. You got to make sure that whoever's helping you wears gloves at all the times. I'll be honest with you too, as she's unwrapping it, it's like that's the hardest part. It doesn't hurt at all, but every time I see my arm I get really upset. I'm gonna try good just to make the video and stay disconnected from it, but you'll see what I'm talking about in a minute. It's actually healing really good, but it's kind of hard to see yourself cut down so far the way they do it, but it's healing good, so that's good. Every day I see that it looks a little better. It's easier when you take the gauze off if you continue to roll it in a roll, because you've got to put this part right back on again. It's kind of funny, the first couple of days were a little awkward. Now I feel like we got a professional process down. So that cloth right there, the doctor will give you along with that little cast type thing they make. So you'll have to buy rolls of gauze, which is what she's taking off right now. And then there will be a couple of gauze pads underneath this roll of gauze that cover those 5x9 zero form bandages that are yellow. They're also very moist. So when you put them on, it feels good because they're cooling. So you can see the remnant of the scar there, and you can see my hand looks a lot thinner than, or my wrist looks thinner than my hand. So you gotta be really careful when you take off this part, because the first time I did it, it was kind of stuck, but I didn't change it when I got out of the hospital. It needs to be changed every single day, and usually it doesn't get stuck if you do that. But so by the time you change it the next morning, these yellow bandages will be dry. They're wet when they go on. So this is my arm. It actually looks really good, but it's hard to look at yourself kind of dissected like that. And then you can see how fat my hand still is. It's very swollen still. You have to keep it elevated all the time, and that's probably the hardest part. The doctor said it takes a long time for the swelling to go down, but if you look when I turn my hand, see, that's what always freaks me out. That just, it's like my bone and some muscle. But anyway, there it is. So here go the new bandages, and that part right there feels good. It's cold and wet. So they just overlap like she's doing. Then you get the 2 gauze squares and open them up like that. Wrap it around. I have her wrap it all the way up to the elbow right there because you're supposed to keep your arm up, and you see how the scar is like all the way up to my elbow where it bends. When you keep your arm up, it makes it hot and it sweats a lot right there, which makes it uncomfortable and kind of gets chafed. So I figured out if I put the gauze there, it's a little easier to deal with. I always have her wrap the wrist a couple more times, make it a little thicker than if she just did it once, because the wrist hurts the most. Overall, the whole thing doesn't hurt. I am on some pain medication. I take about 4 a day, and I could probably get away with 3 now. But where the wrist is cut, the skin is cut away, that's the most tender part. And the whole point of this is to keep your wrist as stable as possible. So wrapping it a couple extra times really helps it feel more protected, makes me feel more secure. And I like having it go through my finger right there, but that part's not really necessary. It just, like I said, makes it feel more stable for me. So once you wrap it all up like that, you get back to looking like a mummy. You tape it,